Welcome to Illuminating Health, the UCSF School of Nursing's podcast that sheds light on health and healthcare issues affecting our daily lives. My name is Aean Peattie, current student in the Adult-Gerontology Clinical Nurse Specialist specialty, and today I'm joined by Kay Burke, UCSF Health's Chief Nursing Informatics Officer and a current student in the School of Nursing's Postmaster's Doctor of Nursing Practice pathway. Thank you for joining today's episode.
Thanks, Aean. It's so great to be here. Thank you for having me.
Artificial intelligence, remote health monitoring, virtual nursing. The potential for technology to enhance patient care and the delivery of service is limitless. At UCSF Health, one of the nation's leading academic health centers, Kay is leveraging these and other digital tools to improve the lives of nurses and their patients. Kay, we're excited to learn more about your work. To ensure we have a foundation for our conversation, please help us understand, what is nursing informatics?
Yeah, absolutely. So first I'll give a high level of what nursing informatics is. And then I thought I would share with you how we are organized at UCSF Health. And then I think it'd be helpful to provide a few concrete examples. As you know, these days, like all clinicians, everyone uses digital tools and information systems to do their daily jobs. So even though nursing informatics has been around as a specialty of nursing practice for quite some time, 1992 to be exact, the field has and continues to exponentially grow, given how ubiquitous technology is now in all of the clinical environments. So essentially, nursing informatics acts as the bridge between technologists and clinicians. And what I mean by that is informaticists are nurses, registered nurses, who deeply understand workflows. They understand information systems, integrations, the digital landscape, and they're able to translate this information to the IT side. And the flip side is true. So while technologists and analysts and software engineers, very expert individuals, they're designing or enhancing these systems, but these IT professionals really rely on informaticists to gather requirements and validate build. So ensuring that what is delivered meets the standards, the needs, and the seamless integration. So in a nutshell, that's what nursing informatics is and what we do. So as for informatics at UCSF Health, we're part of the Health Informatics Division, which is part of what's called the Health IT Department, which is part of a larger IT division across the entire UCSF enterprise. But that said, nursing informatics also matrix reports to Maddie Pearson, who's our Chief Nurse Executive, and the Department of Patient Care Services. So we really do have a foot in both worlds. And then also an additional note about nursing informatics at UCSF Health is it's kind of a misnomer because we support not just nurses. We support all allied health professionals. So rehab services, case management, social work, nutrition services, respiratory therapy, as well as advanced practice providers. And so just a few concrete examples that are hot off the press. You probably know that CMS has new legislation in which we are required to collect social determinants of health on all of our patients. So where does the documentation live, right? We know we need to collect this, but it has to be intuitively embedded in the workflow. So what are the fields? Where do we put them? How do we actually scrutinize what is already in the system that we take out? Because now we have two additional, assessments that nurses have to do. Likewise, a huge project right now is implementing a lab modernization module. So how do we make sure that we are designing the workflows so that when we have specimen collections with devices and iPhones, and we are ensuring that nurses are following the workflows with this brand new project so that they are not negatively impacted with the implementation of this large scale effort.
That's great. You went into this a little bit already, but maybe you could expand on why nurses are uniquely positioned to lead this work.
Well, nurses entered this profession to take care of patients, right? To improve health outcomes, to be healthcare practitioners, not to be computer programmers or IT experts, right? So nurse informaticists really get this. So if health systems design and implement and support all of these digital systems and tools without nurses who truly understand the workflows, we're doing frontline caregivers a total disservice. So a very common, simple scenario. So a nurse submits an enhancement request. They're like, please add a checkbox to the admission navigator to capture something. Or please create an alert because we need to remind nurses to do something. Well, like an analyst receives these requests and they have no idea what the nurse is talking about, how this change might impact existing workflows, or what the clinical implications of this change might be. So this is where nurses come in. These nurse informaticists are consulted to actually map out the change requests. They determine if this is clinically appropriate or even necessary. And if so, they help the analyst design the changes in the system, and even helps the changes go through like the proper governance processes to approve if applicable. And then lastly, they help to ensure that communication channels and educational materials and a support rounding schedule is established so that when these changes are delivered in the production environment, which means they're live in the system, they're able to help those frontline clinicians navigate these new changes.
Great. And what brought you to this field?
Yeah, it's kind of a funny story. In short, complete impatience. So when I first was a nurse, like many of us who entered the profession, and I've been a nurse for 25 years, it was all paper charts, right? So those big, huge, heavy binders, and somebody else was working on the binder, so you couldn't access that chart. And then in like 2003 or so, I became a cath lab nurse. And so that was interesting because all of the systems were not integrated. So I had to document fluoro time in this system and the meds I administered during the procedure in this system, and most of it on paper. And I was like, this is bananas. I cannot believe that this is what I have to do after every case. And then the kicker was I was a nurse manager in a very large scale ambulatory care center. And now I was responsible for the happiness of my staff, right? As leaders, we want to make sure that your nurses are able to practice efficiently and effectively, and they couldn't. And this is when we were in a full scale EHR environment. And this was epic at the time. And that's also what we have here at UCSF. And I started to be creative about like, how do I independently configure or personalize some of the tools within the EHR so that my nurses could actually be more effective in knowing who's up next and how do you communicate with your provider, et cetera. So I decided, I was like, you know what? I can't complain anymore. I just need to learn the system. So I quit my job as a nurse manager. My husband, nursing administration, my mom were like, what are you doing? And I became a systems analyst one. It was like a huge pay cut. What's a systems analyst? I was like, I don't know. Why are you going out to training in Madison, Wisconsin every other week? But I learned the back end of the software so that I actually could be part of the change that I've wanted for so many years. So in some cases, I grew up in the IT space, earning my stripes to understand how these systems are configured. What is an interface, right? How do you do like change control? All of this tech talk that most nurses don't know, nor should they. And so that's kind of how I became an informatics executive and kind of continuing to advocate for this field and build my team and really make sure that nursing informatics is a critical function of any health system.
So at UCSF Health, how is nursing informatics driving improvements for nurses in their day-to-day work?
Yeah, so I'll give you a few additional examples, but more in the sort of utilization space. So we talk a lot about user adoption. There's a huge human-centered design aspect of this field. So like when workflows are standardized, but nurses are not following them, nurse informaticists delve into that gap and investigate, like, is the workflow not intuitive? Is it too burdensome? Is there a knowledge deficit that needs to be addressed? What are these barriers to utilization? So we're a lean organization, and what that means is it's really important to what's called go to Gemba, or observe what's happening at the front line. So nurse informaticists carry this job responsibility. To that end, we're part of this consortium. It's called the Arch Collaborative. And really, it helps us gather data, informing us how satisfied nurses are with the electronic health record, benchmarks against all of the other health systems in this collaborative. And it measures essentially 3 different categories of satisfaction. And the first is training. Like, how well do you feel like you are supported? Not initially, but even on an ongoing basis. This is what makes you a strong user of the EHR. The second one is it configured for your unique workflow, right? Taking into account the specificity of your role and the practice standard within your discipline or your care setting. And then the third one is your voice heard? Like, is there strong governance? Can you submit a change and know where that's going, or submit an idea and know that that might be listened to? So that's something that we continue to survey our users just to make sure that we are making data-driven decisions around our improvement sprints. And so that's something that I think is really important to call out. And then the last thing, real briefly, we're really proud of this. I cannot take personal credit. My amazing nursing informatics team contributed to this, but we are now in the third year of an informatics champion program. So we launched this in 2022. And really it's designed to like advance the footprint of nursing informatics. So it improves the engagement of frontline nurses and allied health professionals who are really, really interested in this specialty. We want to make sure we're infusing nursing informatics competencies across all levels of nurse, not just a centralized, nursing informatics department. And so around 10 informatics champions are selected every year, and they represent like a variety of care settings, patient placement, procedural, inpatient, outpatient, both pediatrics and adults, rehab services. And they're assigned a one-to-one mentor with a clinical nurse informaticist. And then they have to deliver a project at the end. And super, super like heartwarming to see these project presentations at the end, because these are frontline nurses. These are those who are embedded in units or embedded in ambulatory care centers, and they're actually leading change. So much like I shared with you at Children's Hospital of Philadelphia when I was a nurse manager, like they are now the change they want to see for their specific care setting or their unit or their department. And so some examples real quick. One, informatics champion decreased the total of minutes of documentation in procedure navigators by 20%. Another one, who is an occupational therapist, streamlined the entire chart review process. And then there was somebody else who really eliminated all of the manual data entry for interdisciplinary rounds. And then somebody else who identified duplicative documentation and eliminated that. So those are some kind of improvement examples that I think are unique to our organization and unique to nursing informatics at UCSF.
I love that concept of the informatics champion program. That I think I can imagine that is very helpful. I know that I get frustrated with charting at my facility, and I would love to sit down and tell them how to get rid of all their duplicative charting. I'll keep an eye for that. So let's see, we've heard about how informatics is driving improvements for the nurses. How is nursing informatics improving patient care at UCSF Health?
Yeah, that's a great question. So probably the most important question, right? So some examples, again, I'm going to start with examples. I think they encapsulate the answer more effectively. So we all know about hospital-acquired infections and harm prevention, and really the key role that the nurse plays in those prevention efforts. And so we have this dashboard that we recently implemented, actually within the last 4 years, not that recently. It's called the Hospital-Acquired Infection Dashboard. So you're a nurse, you're not adhering to a prevention bundle, right? So we have our central line associated bloodstream infection, your catheter associated UTI, prevention bundle. And it's because you probably forgot to assess something or you weren't sure of the components of the bundle, right? So these are like real-time feedback. There's no lag that indicate to you that this patient has some missing data elements. Did you forget to document, or do you need to go back and conduct that assessment so that you can make sure that you are preventing harm for that patient? Another example is barcoded med administration. We all know that evidence shows that BCMA results in medication error reduction. So we have scanners, and you want to make sure you're scanning to verify that it's the right patient, it's the right medication, it's the right dose before you're administering meds. So we have scanners everywhere, but now we've started to use our iPhones. So all of our nurses are tethered to iPhones, and they have scanning functionality. So if the scanner's missing or it's broken or what have you, they're easily able to use their phones to improve the BCMA compliance rates. Another thing is called clinical decision support. I'm sure that this is a term that most are aware of. And this like automates routine decisions, right? So creates very simple reminders. So it's allowing nurses to focus on more complex aspects of patient care. So let's just say there's an order in the system, and for whatever reason, it's contraindicated for that particular patient. So this information will pop up asking the nurse to confirm that, yep, this is an acceptable order. This is, safe to carry out. So that's an example of clinical decision support. And these are all tools within the electronic health record that support both quality and patient safety. And then just a last, since I already mentioned iPhones, I'll say one more comment about this. All RNs use iPhones. We have this application, which is called Volt. It's our clinical communications application. And it really makes it easier for nurses to communicate, right? Finding the provider, finding their interprofessional colleague, talking to each other. And with this clinical communication on these iPhones, there's a ton of integration. So you can also look at your patient's waveforms. We have waveform integration, right? Or nurse call. So we know through the phones when the patient has pressed the call bell. So nurses are able to more efficiently respond to patient needs, like on the go, which I think is really important in the spirit of, patient care and quality and patient safety.
Artificial intelligence in healthcare, I think, is top of mind for many of us. In what ways are you excited about the potential for AI in healthcare, and in what ways are you cautious?
Yeah, I'm excited. I'm excited for this topic. So I will try not to have my inflection go too high and low because this is a topic in healthcare that is very near and dear to me. But let me start with just a definition. I think sometimes folks aren't totally clear on what artificial intelligence is in the healthcare space. So AI, it's simply computer programs that process reasoning. So essentially, these are tools that think or act like a human, like designed to act rationally by using this intelligent software. So there's many types of AI. What people don't realize is that AI has actually been around for a long time. So a few examples of things that and you've known for years that actually are wink, wink AI. So firstly, predictive analytics, sepsis risk prediction. That is AI, because what you're doing is you're using an algorithm to look into the future for a potential deterioration. You're incorporating all these data elements into a risk prediction, right? HAPIs and falls, so hospital acquired pressure injuries and falls. If you can look at all these risk criteria, and then you're able to ensure that with the calculations of all the different risks, you can then put in front of a clinician, hey, careful, you have a patient in front of you that might develop a HAPI, or you have a patient that you're taking care of that actually has a higher tendency to fall, so be extra alert, right? That's all AI. Now, more recently with predictive analytics, we opened up our patient capacity management center. So that's essentially our air traffic control for patient flow. In fact, when we opened it, I really wanted to call it care traffic control, but that didn't fly, so that's okay, but you get the picture. So when you're talking about all these points of entry and being able to accept, transferring in patients and address the, surge in the ED, et cetera, and then you need to get these patients out. These predictive analytics can really help with predicting what is the next bed that will be available, right? What are some expected discharge delays that are going to happen in 6 hours? What are the, we call it the OR come and go. We know actually what the ORs may look like in 12 hours based on what's already scheduled, right? And so these are some more kind of operational efficiency predictive algorithms that we have live. And that's all not necessarily new. Now, some of the new AI, I'm sure you all know what generative AI is. And if not, just very simply, it's generates text responses from prompts and suggests a draft of documentation. So think Microsoft Outlook. If you're ever writing an email, there's like the next few words, there's a suggestion, right? That's essentially Gen AI. And within sort of the nursing informatics realm, we have a few examples. So one is called in-basket intelligence. So we're able to have nurses who are responding to patient requests based on a lot of the data within the patient's record and based on the prompts of the request itself, start to draft a response back to the patient. And, again, this is simply a draft, but it does save time. And that's an example of generative AI. And then another kind of area that's emerging, and I get very excited about this, is ambient intelligence. So this is like Gen AI, but instead of text, it's using voice to organize the prompts and suggest documentation drafts or the next course of action. So in this case, think Alexa, right, or Siri. You weren't, voice to texting 5 years ago. You were just texting with your fingers. This is really voice to documentation. And there's a couple of emerging projects that we're talking about here, which is, just voicing simple assessments in an acute care setting. And as you're articulating the assessments into the phone, it is filing those simple assessments into flow sheets, and then you're validating what you saw for it to be filed to the EHR. Also transitions of care, right? So a patient's coming from a procedural area back to the unit. The procedural care nurse needs to talk to the inpatient nurse. This is a conversation. Well, the conversation can easily be captured into a note, absent somebody documenting it, right? That's another good example. Or triage. You're talking to patients in the ED or you're doing ambulatory nurse triage. Ambient intelligence can capture the conversation and file it to what is the logical or most appropriate place in the electronic health record. So those are all examples that are exciting about ambient intelligence as well. I will say, if I can this is a little bit of a plug because I think it's maybe one of the most important things to note, is that like any use of AI, right, any of the examples I provided, any vendor, any software program, any machine learning algorithm, what have you, any AI use in patient care will never remove or negate the necessity of a nurse, right? Nurses will always need to apply clinical judgment and critical thinking in how they take care of patients. So, never will staffing ratios be changed or hiring practices altered or a workforce footprint decreased, because every AI tool necessitates a clinician to review and validate what was suggested. And so I think there's unfortunately a lot of misinformation out there on what AI is and what AI is not. And so for me, I get very excited about this, but I'm also very pragmatic about some of that misinformation. And so I plan to spend the next several months, probably years, communicating and educating and demystifying the capabilities of AI, because really, I think this can really make nurses more efficient, more, they may find more joy in their day-to-day job, bringing nurses back to the bedside. I will say I didn't answer one part of your question real quick, which is what am I cautious of? It's important to also call this out. So it's really imperative to recognize the ways that AI's misuse may exacerbate structural racism that exists in healthcare. It's really important that there's something called black box AI. So what this is, if you think about, the black box on an airplane, this is like an impenetrable system. You don't know what the sources are. You're not sure if something arrived at a conclusion, but you don't know how the conclusion was reached. Then that can be very dangerous. It's very complex. So you really need to make sure that, and there's legislation and there's governance. UCSF Health is all about what we call transparency and trustworthiness. So ensuring that these data, these AI algorithms are transparent, you need to make sure you knew where every single source of information came from and that the sources of information were accurate and trustworthy. All of that happens before we even consider delivering anything to clinicians and caregivers. So, without transparent explanation and how that conclusion was generated, we really can't identify and eliminate bias in care delivery. So, that's also another thing that I'm cautious about, and I think that everyone should be.
Well, that's very reassuring that that UCSF Health is aware of those issues and that they are prioritizing transparency in their AI. When you look 5 years down the road, what are your predictions for the future of nursing and technology?
So much. You used the term limitless in the beginning of this podcast. And I love that because there's so many things to talk about when we look to the future. One thing that I wanted to briefly touch upon, because you also mentioned it, which is virtual nursing. So this is exciting. It's a real shift towards a more contemporary care model of professional practice. Once again, this is not totally uncharted territory. We've been doing virtual care for years, like telesitting and telemedicine and EICU, and even when COVID opened doors to enable virtual consults and virtual visitation and virtual medical interpretation. I mean, not just to minimize exposure, but to preserve PPE. So there's been an explosion of virtual care use cases and options within the last 5 years. That said, I feel like we really are on the precipice of forming like a more holistic definition of virtual nursing and how virtual nurses are totally integrated with the care team and like established as a critical element of patient care delivery and the professional practice of nursing. So essentially what virtual nursing programs do, they have centralized virtual nurses. They are not on the unit. Some programs have these nurses at home. Here, when we piloted it, we just had these nurses in like an administrative suite. And there's many different assessments and tasks that don't need to be carried out by a person at the bedside or a person proximal to the patient, right? Think about all of the admission assessment requirements. A lot of them are not physical assessments. Pain reassessment, you know what I mean? Or patient education, that takes a lot of time. And oftentimes you don't need to be there physically in person. And so there are many criteria that are appropriate for a virtual nurse to partner with the nurse proximal to the patient so that they can be more efficient and effective and more timely in actually getting these patients out of the inpatient setting. We talk a little bit about personalized medicine. So I'm switching it to sort of the more consumer-facing, patient-facing opportunities in the future. But having X condition does not necessarily mean that you follow Y treatment. We all know this, right? But absent some of these technologies to support more personalized medicine, oftentimes your care pathway is not tailored to what you need. It doesn't have the precise treatments for you as an individual. So it kind of refers to like healthcare strategies that are customized to the person's genetic, environmental, lifestyle factors. Like this is where social drivers of health really come in. This is where genomic data analysis comes in. Like, do you have any genetic mutations and patterns associated with disease? And so really precision medicine, it's broader than just nursing, of course, but I think when we talk about the future of healthcare, we really are talking about advancements in personalized medicine. When you think about precision drug development and remote patient monitoring and wearables, which we haven't talked about yet. If you are able to share those data with your caregivers and your care navigators, you have a complex chronic illness, there's ways in which you are able to have more and more precise interventions, precise pathways so that you can be a healthier individual. So I think that's a really important thing to mention specific to AI and personal medicine, personalized mental health. I mean, that's a huge area of opportunity in the future. So people say, okay, what is the future of technology in nursing? No. The future is nurse empowerment in delivering innovative patient care as enabled by technology. So I think really the future is how nurses are going to advance their practice enabled by technology and advancements in AI and automation and all sorts of other things that are coming down the pipeline.
Well, thank you, Kay, for joining us on this episode of Illuminating Health. And thank you to our listeners. We look forward to connecting with you next time.